Maybe. All right. Hey, everybody. Welcome to Ask Our Vet, brought to you by Rockwell Pets Pro. Each week, we're going to be discussing a different topic in veterinary medicine. I'm Mike, I'm Mike the Voice Monkey, and I talk for a living. And as always, I'm joined by Dr. Max. Dr. Max, how is everything going? How is your hand doing, first of all?
It's wonderful. Thank you so much for asking. Doing a lot better. You can hardly even tell that there was a horrible cellulitis a couple weeks ago. Very grateful to be improving. Animals here in New York, many of them are doing well. Others not so well, but we're trying to take care of them. And yeah, overall can't complain. How are things by you?
Doing great down here. The weather's good. We had some storms earlier today, but to be expected this time of year. And no, it's warm outside right now. As you can see, it's sunny still outside. I love daylight saving time, so it's my favorite time of the year. Any cool, interesting cases this past week? I'm assuming you're back to work and back to 100%.
Yep, back to full functioning hand, back to full functioning hours at the clinic. This week, let's see what stands out. Today we had ringworm a couple weeks back on our podcast. Today we had a family who brought in 5 of their cats. They have 6 cats. They brought in 5 of them today, each in its own specific, pretty heavy duty luggage, like color coded, like suitcase thing. It was more than the typical carrier, so they definitely take good care of their cats. But 2 of them had diagnosed ringworm. They'd all been hanging together, and they wanted them to be checked. So that was quite a handful, literally.
Why did they leave the other one at home?
I think that one's older, and it kind of doesn't do well with the other cats.
They don't care. Yeah. So.
Yeah. Yeah. So that definitely stood out of my memory today. Had a dog with a pretty severe oral hematoma. Maybe I can even show a picture, not to identify the dog, but I can show a picture of the ear, and you guys can tell how awful that looks.
Oh yeah, that's like a little pillow. Yeah,
pretty much.
Now and everybody who's watching, if you guys wanted to ask some questions, first of all, you can go to the register at the Rockwell Pets Pro book page for Ask Our Vet. You can register there, ask questions. We're happy to answer any questions. Tonight, we're going to be talking about ear infections, but it could be just anything veterinary pet related. Send them on. So tell us about the hematoma. How did that go?
Yeah, I mean, well, the dog had an ear infection, and so hematoma is a potential problem that arises from some underlying cause. And in this case, an ear infection. Dog's ear is itchy. She was scratching at it, shaking her head violently. And really, that's the thing that did it. That shaking of the head violently, banging up against the body or furniture or whatnot. It's going to just, those little capillaries in the ear is going to burst, and it's going to lead to all that swelling in the subcutaneous space, and hence that hugely inflated balloon of an ear, and it just was really painful. I felt really badly for her, but it's not like it just happens. There's something that triggers it, and I guess today's topic is what was the underlying cause in her. And she had a number of other issues. That was just the one that relates to the ear. She had pretty severe pododermatitis as well. And for those listeners of ours, that's kind of inflammation of the interdigital space, like between the toes. And on each of her 4 paws, a lot of redness and inflammation. And she'd been licking at it for several months. And so there's a lot of underlying skin stuff that this dog is going through. But
I know we'll get into it, but the ears are part of the skin. So if the dog has problems somewhere, it's going to be elsewhere. How did you treat the hematoma today?
So There are a number of ways to skin a cat. Surgery is really the best way to go about doing this. I was on appointments all day and literally wouldn't, like, I was thinking about draining it just because I wanted to relieve some of the pressure. The owner was adamant against that it had been done to the other ear, I think several months prior, at like the Humane Society, and he wanted to, just go do the surgery. Our surgeon who was working today had a full schedule, so we weren't able to get her in today. I recommended, it's fortunately not like a life-threatening thing, such that like a pyometra, for example, where you really shouldn't let the sun set on a pyo, and don't put this off. But I wanted to give her some comfort, so I sent her home with some pain meds, anti-inflammatories, and I did as well as I could without really, without sedating or anything, cleaning that external ear canal as best as we could, and sent home with some like wipes for her paws, and scheduled her for Tuesday when we had availability for surgery. So
what kind of surgery are they going to do?
So they're going to incise the internal portion of the ear, like of the flap, the inner flap, squeeze it out, as all that juice, drain it. Likely, I mean, I guess I don't know who's on surgery that day, but put a little drain in there, and kind of suture that in, and then let that kind of drain the remainder of discharge and blood that may be present, and probably recheck in a week, and then take that sutures out and take that Penrose drain out. What I could have done for her today would be simply sticking a large board needle into space and kind of just get in as much of that we can, evacuate all that high pressure system, probably make her feel a lot better, but it's
just going to fill right back up.
We would fill right back up. Exactly.
Yeah. I've seen those treated so many. They're hard to deal with because the dog's going to be flapping. You can't stop a dog from flapping. And I've seen them teat cannulas, shove them in there, suture those in. I've seen them mattress suture the ear together just to keep it. I've seen them take pieces of x-ray film and cut them and put them on the back of the ear, suture that so it gives a nice flat, even pressure on the buttons, things like anything to do to get the ear to kind of scar down and not fill up. But just draining it's going to make them feel better. But then they're going to go home and shake their head and it's going to go blood everywhere. So that's
exactly. It won't solve the problem.
Nobody likes that.
I haven't heard about the x-ray, but the teat cannula is a good one.
Well, vets are known for MacGyvering their way into like, super jank, just like, what do we got? Suture this to it. I learned this one time in the back of a truck at a cow farm or something, but it's, it's funny what you pick up along the years. Yeah.
And then, and we sent her home, it's a very simple piece of, in our artillery of treatments, but an e-collar, a cone that she'll likely go home on just because I don't want her to continue to self-traumatize it, or, she'll probably try to, but, it's best to create some sort of barrier.
Yeah. Hematomas are tough. They're a tough nut to crack. So it's something that takes time. It's not an easy fix. And likely there are several surgeries. I've seen definitely a lot of cutting open and suturing down and
the blood gushing and spurting. That's really
that's the best part.
That's exactly the PS.
It's like an overfull ketchup packet.
Yeah.
And you just
on one of our rotations in vet school is like the one in it's called Tufts at Tech, which was actually a really cool program. It was a collaboration between Tufts, the vet school, and a vocational high school in Worcester, where the students were studying to get their high school degree, but also a certificate or degree in like veterinary assistant science. And so it was cool. It was a lot of like affordable care for community members. Bring their pets in. We weren't vets at the time, but there was vets on the premises to kind of help guide us with our cases. And I just remember watching one of my friends do the surgery, and the vet, who was the head at the clinic, had us all like come in. So we came in, and then as soon as she incised the skin, just blood just came. It's like projectile. Very exciting.
Those are the best things when stuff squirts out of unexpected places. That's
true.
You ever seen the videos of the farmers with the cows that have abscesses and stuff, and they just, it's on YouTube, where they just, the cows in the chute or it's somewhere, they just go up and go, and stab it.
Yeah.
And it just goes, it shoots out across, just gushes across.
And it gushes. Yeah.
Yeah. That's so much. Gosh. I think we just lost all our viewers, but yeah, no, it's, see, if you're in this business,
so gratifying.
That's
it's
fine.
Like,
yeah,
it
is.
The most gratifying thing. Yeah, I love it. If we can, a fluid tap from the abdomen, or find a cyst and then we can drain, or whatever it may be. It's like it was a high pressure system. We got it down.
Right.
And I don't know. It makes me happy.
As a victim of abscesses, I know how painful they are, because there is so much pressure built up. I had an ingrown toenail when I was in college. They got infected, and I could barely walk. It hurt so bad. And one night I just said, I'm going after this thing. And I just went like, and it popped, and all the pus came out, and it felt immediately better. I was like, oh, and I just kept the pus out, and I was fine. So, I've had abscesses before, and they're not fun. I can only imagine what our poor pets are going through. And, I guess their skin's a little more pliable than ours, but still, when it's that pressure is built up, it hurts. And, we get that number 11 blade and go, and stick it in there, and then problem solved. It's amazing.
Yeah.
So, again, if anybody wants to ask a question, please ask us some questions. Go to the Rockwell Pets Pro page for Ask Our Vet, and sign up. Send us some questions. They'll show up on my screen here, and I'll throw them up on the screen. They don't have to be related to our topic. They could be any veterinary question. Rabbits, talk about rabbits, anything like that. No, we can do anything. Send us the question. So tonight's topic, might as well get to it here. Ear infections. That's how often do you see ear infections in a week? How many ear infections do you see?
On a daily basis.
Time of year, yeah, but
yeah, I guess it varies. But I would say on a daily to every other day basis, usually. It's pretty common. Today I had two dogs who came in with suspect ear infections. One of which had one. So it is probably one of the more common things.
I know it's kind of an obvious question, but what qualifies as an ear infection?
Yeah. So otitis externa would be the medical jargon. It's inflammation of the external ear canal. And what qualifies? Bacterial infection, fungal infection. Those are kind of the typical offenders. Then there's also like the parasitic infestations that we think of, such as ear mites. Would be a common one that can kind of fall under that umbrella of things that could be causing ear related inflammation.
Now, Dr. Max, I don't want to alarm you, but we have a question.
Oh my God, amazing.
Somebody has asked the first question. This is episode 7.
Oh my gosh.
So let me click on it here. Let me see. Hold on. There it is. From Rachel McLean. Any home remedies for an ear infection? Getting a little ahead of ourselves here, but it's our first question. I had to put it up there.
Rachel McLean. Rachel J-Fan. I don't know if I'm pronouncing that correctly.
Sorry, Rachel.
Yeah, forgive me if I mispronounced Chaitan, your middle name. But yeah, insofar as home remedies for ear infection, um, there are. I'm not guaranteeing that any of these natural remedies will work, nor can we ever really make a guarantee that the drugs that we prescribe often to, perhaps to your dog, are going to be 100% effective. But there definitely are things that you can do at home. Thank you so much. I appreciate it. Getting, you got to stay hydrated. So forgive me.
That's right.
Yeah. So as far as topical remedies, there's stuff out there like apple cider vinegar, calendula, which I think I had spoken about earlier.
Isn't that a movie from the 70s? No.
Caligula, maybe. The Roman Emperor.
I don't know. Yeah. All right. Never mind.
Anyway, that's it's like in the marigold family, and they have some nice ointments that are really good for inflammation, and that can kind of be natural products that you can apply topically. Those would be the home remedies that I'm familiar with. I'm sure homeopathic vets have other ones, but those are the ones with which I'm familiar.
Wouldn't you say it would be a good idea to figure out what's causing the infection, and two, is it middle ear, inner ear, external ear? Because if you're putting stuff on the outside of the ear, and if it's deeper down, it's not going to help.
Right, for sure. So we did jump a little bit, and that's totally fine. I'm just honored that we got a question.
I know.
But yeah, so we had been, in talking about otitis externa, that's obviously the external ear canal, which is composed of like the vertical, horizontal canals. We can get we as vets, in terms of our diagnostic capabilities, at least in my context as a general practitioner, using an otoscope, to kind of take a look, and that little device that takes us into the ear canal, to assess the walls, the lining of the ear canal, up until the tympanic membrane. So seeing past that, the eardrum, you can't really see further, and then being able to diagnose otitis media or interna, middle or internal ear infections, would require some advanced imaging. You're talking like CT scan at that point. But insofar as the external ear canal, what I do on a quite frequent basis, taking some swabs of the ear canal, getting all that gunk and discharge out, putting it on a glass slide. Typically, we have like this three-part staining method, and then taking a look under the microscope to identify, common offenders would be spherical shaped bacteria or rod shaped bacteria, or budding yeast. Those are things that can be often seen. Potential for otodectes, which is an ear mite. Those are things that would be picked up on the stain in the external ear canal. So definitely trying to find something to which we can treat. So if we were to find a huge fungal infection, malassezia, a species of yeast, treating that with an antifungal ear medication would be a good idea. It could be a mixed population, bacteria and fungal, and those are the common things that we see associated with ear infection. Now, we can start on a specific drug cocktail, and common. There's so many ear medications out on the market. and different hospitals will carry different products. Some of them will be, will have part antibiotic, part antifungal, and then a steroid component to kind of like this three-prong approach to treatment. And that could be good, but it also may not necessarily do the trick. So for example, if there's a huge, say malassezia fungal infection, and then we treat with a specific medication, 7 days, once a day, the ear canal, and the dog's doing a lot better, but maybe not 100%, but maybe, for example, if the owner were to stop, potentially even too early, or does not do like a repeat of the cytology, it is possible that, those little fungi can develop resistance, and then, a couple of days later, back at it. So there is importance and utility in doing repeat diagnostics, depending on how long, or, whatever the veterinarian, however many days, or the frequency of administration recommends prescribing the medication. Often, for me, the most important thing is the dog's quality of life. But I also do recognize and often tell my clients that there is possibility of, recurrence, especially if the entirety of the treatment course hasn't been finished. And so I think, absolutely, Mike, to your point, identifying the cause is a really big, a key factor in this. Yeah.
Excellent. Well, Rachel, thank you so much for asking our very first question. You win the prize of, I don't know what the prize is, but if anybody else would like to ask a question, definitely send it on in Rockwell Pets Pro, Ask Our Vet page, register there. I think you can ask a question from there. I don't know if you can ask one from Facebook or not. If you can, give it a shot. It'll show up on my screen just like Rachel's did. We'll throw it up there and we'll talk about it. So, Dr. Max, tell everybody the difference between, anatomy-wise, a dog or a cat's ear versus a person's ear. Can you just stick your finger in there and swab it out, or how are dogs' ears different than our ears?
So yeah, I mean, I guess when answering this question, there may be it may be loaded in the sense of like, what can we do about it from like at home? Because it's one of those things that,
right,
seems seemingly so simple. You can visibly, you as the owner, see all that discharge or the malodor, and it smells awful. Your pet has been scratching at it, shaking his or her head. There's excoriations, maybe scratches on the back of the pinna, like the ear flap. So you see it and you feel as though you can do something about it, and you very well may be able to do that. But there is definitely more difficulty in treating it and potentially swabbing. If you wanted to get a Q-tip and start kind of digging out, in that there's like a vertical component, and then a horizontal one that will lead you to the tympanic membrane. So it does require some maneuvering and care in terms of feeding, some sort of swab or Q-tip. We have like cotton tip applicators, which are quite long, especially for larger dogs to kind of get down there. But definitely you can do a lot of damage depending on how far you start kind of prodding. And that can lead to some difficulty just because of that L-shaped anatomy, in terms of getting as deep as you can, because sometimes you can do a great job cleaning out the visible portions of the ear canal, but then it's putting a Band-Aid on the problem because there's a lot of gunk that's still left over. And if, an ear infection is diagnosed, how is that, all that gunk that's surrounding the epithelial surface, it will be difficult for the solution that's going to be pumped into the ear canal to kind of get absorbed, into the skin, if all that gunk is in the way. So, that's part of the art and science of treating ear infections, kind of maneuvering through and, doing as deep of a cleaning as you can. And so that's why I often, dogs who present to me for presumptive ear infections, I recommend that we do a thorough cleaning of the ear canals in hospital, just to make the client's job easier at home in terms of them, doing the outpatient medication.
How do you recommend people clean their dog's ears at home? Like, what's the technique that you guys use the proper technique to clean a dog's ear out? Do you just get that bulb syringe in there and go, just squeeze it, or do you, what do you guys do?
Usually not. Usually, I mean, I also preface it by telling them it's usually can be a 2-person job, especially for the really difficult patients. And, there are those that sedation may become a necessary thing. I hate to let them know that. And I also, a really large part of me thinks like, oh, this is like so awful. Like, if only the dog knew. Like, I know it is painful, but it's such a seemingly, I don't know. And forgive me that I'm kind of at a loss of words here, but it's one of those things that it's such a small thing that can really irritate a dog's quality of life. It's something that acutely is very treatable and, non-life threatening. Although, we can talk about like chronic forms of the disease later in our conversation, and that can have, really long-term effects on hearing and, potentially require surgery for certain breeds, Cocker Spaniels. But in terms of like the short term, Basset Hounds, they, they don't know what's going on. Just they know they're in pain, and sometimes they freak out in tremendous ways when we try to, collect a diagnostic finding, be it a swab for, looking on cytology, or a culture, which we have to really speak about. But to actually do an ear cleaning, some dogs are just notorious, and they will try to bite or do anything, basket muzzle, like you need to do everything. And some, unfortunately, do require, short-term sedation. And so I typically will do, kind of soak the cotton ball, with whatever, be it epiotic or malacetic or trizchlor, keto. There's so many different products on the line. Depending on what you're treating, you opt for that specific one. I like to dab the cotton balls, douse them, and then use a hemostat, kind of clip the cotton ball and kind of insert it and gently go deeper into the canal. And then until I kind of get nothing back, that's what I typically do for cleaning.
How would you recommend people? Well, you would have. It depends on what you were using. If you had the the bottle of epiotic or something, we just squirt it in there, massage that vertical canal.
Yep.
Bust everything up and then scrape it out. And we had some places I had worked had a little camera. You'd go down in the ear canal with this camera, and you look at the eardrum and go, oh, look at all the crap on the eardrum, and we get the little loop and scrape it all off. But you're right about the sedation, though. There's some dogs, especially dogs that have had chronic ear infections, that are just, their ears are red and wet and inflamed, and just it's easier. It's more traumatic for them to be held down and have their ears clean and that plus it leads to the dog not letting the owner at home clean the ears because the owner comes at the dog with the gauze or whatever, and then the dog remembers what happens at the vet, and they don't have a tech at home holding the dog, and owners get bit that way, and that's no fun. You don't want to ruin the relationship people have with their poor pets. But speaking of,
sure.
Go ahead. Speaking of Cocker Spaniels, are there breeds that are more predisposed to ear infections? Like what types of dogs normally do you come in? They come in for ear infections.
I don't know if there really is a breed predisposition to ear infections. I would say I do see it a lot in floppy ear dogs, those that, especially in the summertime, they go swimming. Excuse me. Those are, I feel like it's lifestyle and, if you're maybe a Labradoodle or a Golden Retriever or a Cocker Spaniel, but I don't know if there's any known specific predisposition really other than the Cockers. But yeah, it's microorganisms love warm, wet, moist environment in which to proliferate, and the ear canal is like the perfect spot for that on a dog's body. And so I guess dogs who have floppier ears, or if there's some like congenital abnormality and there's stenosis or like narrowing of the ear canal, that can lead to propensity for getting an infection. And then dogs who have allergies, seasonal allergies, that's a huge component. And usually if there's going to be some sort of recurrent ear infection, a couple weeks or months later, I would definitely pin an underlying environmental allergy. So I see that a lot in French bulldogs, and no one is immune to it, unfortunately.
Right.
And in people included. I'm not suggesting that people are likely to get it from dogs, and usually, generally speaking, a dog with an ear infection is not going to be able to really communicate that to another dog. It's possible a dog with ear mites that could, especially maybe in puppies, could jump to another dog and then they could localize there, but generally not considered to be like a infectious disease. Even though it is an infection, it's pretty much localized to the ear canal. But yeah.
We'll get to ear bites in just a second, but if you have a dog that likes to go swimming or takes a bath or gets their ears wet, do you have a particular something you tell people, like, how do I dry my dog's ears out, especially if they got the floppy ears? I know you can't rubber band their ears up, but do you have a particular way you tell people, drying solution, put alcohol in their ears? I mean, what do you normally tell people?
Yeah, I mean, if it's a bath, for example, if they're giving them the bath like once a month or something like that, I'll recommend putting preventatively like cotton balls in their ear just to kind of prevent it. For dogs who are swimmers, they love doing that in the summer. As far as cleaning and drying solutions, I do like Epiotic. It's a good ceruminolitic agent. That's good for drying. So that's something that I typically talk to them about. How about you?
Pretty much any kind of drying solution. It's hard because it's you have a drying solution. It's wet that you use it to dry with these dogs, and it's a tough thing to do. I've seen people rubber band a cocker's ears up. They just kind of tie them together, so they just kind of sit on top of their head like a bun, just to get the air. It's hard to do that with basset hounds. Their ears too big and heavy. But...
Oh my gosh, they like drag against the floor, and then there's like a little keratosis of the ears on the surface that gets rubbed up against the floor. It's crazy.
So ear mites are would ear mites be considered an infection or something else?
Yeah, I mean it's not specifically like an infection. I mean, we can categorize it in that arena of ear inflammation and pathology, but it in itself is an ectoparasite, and it's puppies that are immunocompromised or something. Oftentimes we'll see it in them, but they are gross little creatures that you can see on cytology, which is fun to see them moving around. But definitely, like we don't treat them the same way, and so we're going to need to get the dog on, whether it's topical or for a lot of dogs, with their monthly, if they're taking heartworm and flea and tick preventative, that will usually kind of take care of the certain species of the mice.
Where do they get ear mites from? Just the environment?
The environment, yeah. I think that's one of the big spaces.
They're so gross. So gross. What the? So you mentioned a couple of medications earlier when you're treating, whether it's bacteria or fungal, or how many different medications for how many different causes are there? I mean, is there just a rainbow of medications, or are there a few that are kind of the go-to gold standard?
I would say it's a rainbow, but I definitely have the gold standards. It depends on what I see, but I oftentimes find like budding yeast and spherical shaped bacteria, or rod shaped bacteria, and that's kind of the differentiating point between maybe which antibiotic solution I would use. But for typical things, I like Tresederm. I like Mometamax or Modazole, and these are two things that have a steroidal component, antibiotic, and antifungal, and so that's kind of covering your bases. And you may not find populations of one or both. It depends, but on what you find. But those are kind of the typical ones that I'll reach for if we have them in stock, and we usually do. Yeah.
I remember before Mometamax, Otamax, way back in the Otamax was the precursor to Mometamax. We used to love to just go Mometamax. That's just something. Yeah, it's a long day at work. So, will an ear infection get better on its own?
It could. I don't think that it would. So I strongly advise owners to do something about it, i.e., bring us their dog, and we can treat accordingly. Because I know what I will be treating. I don't necessarily know that the aforementioned, Rachel's question, which is a great one, if all that is going to necessarily take care of the infection. And it also depends kind of on the severity too. There may be scant amount of yeast, like when you look at it under 100x on the microscope, you may only find like 1 to 2 yeast per high power field, but on Bella over there, you're going to find like too numerous to count. TNTC.
Right.
That's Metamax. I do TNTC, and that's a big deal. And so that probably will not get better on its own. I had an ear infection in vet school. The only time in my life, never when I was a child, when I was swimming a lot and stuff like that, I never got it, or I never got one. But in vet school, I don't know how it happened to this day, but I got a bilateral ear infection it started with my right ear. 3 days later was my left ear. And I was on internal medicine rotation at the time. And, it's a big deal. You need to use your ear, your eyes, your ears, your hands.
Right.
Physical exam. and I literally could not use the stethoscope because it would hurt way too much. And let alone I was having a difficult time hearing that week anyway. It was a very strange time in my life, but I required treatment, and I'm so glad I got it. And I can empathize with my patients now in that regard. And so I definitely, wouldn't just let it try to get better on its own.
Yeah, I know a lot of people like to try home remedies, and that goes to a lot of people asking me questions like, "Oh, you work for a vet? My dog has a blah blah blah, or he's doing this, or what do you think?" And my answer is always the same: go to your vet. Go get the diagnostic, because if you're treating it with apple cider vinegar and it's the bacterial whatever, and you're not treating appropriately. If you don't know what you're dealing with, then it's just going to get worse and your dog is going to hate you. So go to your vet anytime.
For sure.
Because it's not that big a deal to get an ear swab, to put it on a slide, look at it. It just takes a little time. It's not a big deal. Yeah. And you save your dog a lot of hassle down the road. I've seen surgeries in the surgery practice, the specialty practice I worked in, where we would remove the ear canal entirely for these dogs.
Yeah, so the Tikabo.
Mm-hmm. Yeah,
the
do a Tico.
Ear canal ablation and bull osteotomy. Yeah.
Bulldogs all the time. We're doing that because they're
cockers too, probably.
Cockers too. Yeah, we've had some larger dogs, but yeah, mostly those that just had chronic ear infections where the ear canal calcifies down and it just closes up, and dog can't hear anyway, and you go in there and you cut it down. Take everything out, get the rongeurs, go after the LBO, and then you go in there and do it and suture it up. And now the dog has a nice opening, and
it's going to save that dog so much heartache in the future, because often with those dogs who just get chronic ear infections over and over and over, that really becomes the only valid option. Yeah. The surgical one.
I know. And bulldogs anyway have all kinds of issues. They're not natural. I love bulldogs, but people tell me I'm getting a bulldog puppy. It's like, oh boy, you better start a savings account for that dog, because you're going to have ear problems, skin problems, mouth problems, breathing problems, eye problems, foot problems. Ingrown tail, corkscrew tail. Yeah, they just have everything that can go wrong with them does go wrong with them. So definitely, if you're going to get soft palate resections, I've held up my fair share of bulldog heads during surgery when I just have to put a leash through their mouth and just sit there and just hold it up while the doctor goes in there and cuts that soft palate. Because the dogs,
or their nostrils, if they need the nares, nares.
Yeah, they've got the cherry eye. They've got the eyelids that roll in, and their eyelashes stick into their own eyes and cause problems. Skin problems. They always smell. Speaking of smell, if you're looking at an ear infection, smell it. It gives you a good idea of bacteria, yeast.
Sure.
What's going on?
Okay. Absolutely.
Describe the smells.
If I really want to, I don't want to puke right now before dinner. No, but you can smell the yeast sometimes. You just know for that bulldog is there. You lift up the ear, and meanwhile they're trying to lick your face off, and then you don't want all that in your face. But
you're just like, ugh.
Anyway, yeah, pretty much. I'll take it over anal glands, granted, but it's not the most.
Depends on how chronic it is. Sometimes it can be just, the poor cocker walks in the room and you're like, oh yeah, that's a yeasty beastie. So what can people do to prevent their dog from getting ear infections?
Well, like you said, keeping it dry. That is the best piece of advice that I would recommend. And listen to your vet and bring your dog to the vet if things go wrong. But keeping it dry. today was a pretty rainy day here in New York, and I had a couple dogs here for ear infection, and I told them not on their way walking to the vet did it happen, but it definitely wouldn't help to have the ears soaking wet when they come in. We need to dry them up and towel them down, and then eventually we're going to be discharging them. They go right back out into the rain. But I tell them, when you get home, get some dry gauze or cotton swab and try to clear that out. Even though we've already taken care of cleaning, but in addition to whatever medication we may have prescribed, whether it's a dog who is in the midst of getting care for his ear infection, or one who may have had a history of it, or may be predisposed just with the flappy ears, or a bulldog or something, going home with epiotic and doing that like once, 2 to 3 times a week, I would say, in both ear canals. And like the method that you mentioned, I think is a great one. I typically douse the cotton balls, but if they want to just splash the 3-4 drops, I guess it depends on the size of the dog, but say like 3-4 drops into the ear canal, splash it around, and then that could be a good thing from a prophylactic standpoint.
And a lot of times when you're squishing it around, the dog's going to go and like tilt his head toward it, because it's going to feel good to getting all that stuff around there.
Yeah, exactly.
Yeah. Unless you're super chronic, then he may bite you. So yeah.
Right. But a lot of dogs, like, you're absolutely right. Those that go crazy and need sedation, it's a spectrum. Those that there are those that require sedation, and there are those that when they come in for that bad ear infection, they'll lean into it and they're going to really enjoy it. And I like it. It's the start of them hopefully feeling better.
So when you talk, let's talk a little bit about the ear kind of flap itself. When you're treating a dog, we're talking about the ear canal and we're getting all the stuff out of there. What do you guys do to treat if the flap itself is red and infected? You're
saying if the dog scratched the
underside, if it's like leading out from the ear, the opening of the ear, if it's red and inflamed, and you talked about steroids before, but would you put them on an antibiotic for just a topical skin, either from scratching or just being down and moist and just irritated?
Potentially. I mean, I definitely like to, my first line of therapy in treating, your run-of-the-mill external ear infection will be topical. Mm-hmm. But I guess depending on the severity, and if there hasn't really been significant improvement, and if there's questionable efficacy, in the initial, or after a week, initial stage of treatment, we may do a culture or something, and maybe the antibiotic we chose topically doesn't work. Potentially, I would prescribe an oral antibiotic and or steroid, depending on the severity of the inflammation. But I generally avoid those if I can, just because of the possible adverse side effects. But it's definitely on the scope of the horizon, and it's not wrong to do that, depending on how treatment has gone thus far. But there's definitely a possibility.
If you have a dog who is scratching at their ears, is that a 100% sign that they've got an infection, or might there be something else?
No, absolutely not. Which that underscores the importance of before even doing a swab or cytology or culture, definitely, trying to look into the ear canal with the otoscope, see what you can find. It's possible there's polyps. It's possible there's, it was a cat that I saw recently, but it had a tumor in its ear canal, bleeding tumor, and it smelled. It honestly, that was one of the worst smells that I've ever smelled, I think. Poor guy. But he had surgery and doing better. But yeah, so dog scratching at the ear is not necessarily equal to ear infection. So could be ear mites, could be neoplasia or cancer, could be a foreign body, some sort of plant or dirt or pebble or I don't know, and crazy things. I honestly don't have too much experience in finding a foreign body in the ear canal. Have you come across that?
No, not really. No,
okay.
I don't see a lot of that. But could it be just water in the ear? Maybe it's just kind of something's bothering him, and he's just going.
For sure.
And they can't tell us.
For sure. Yeah.
They can't say.
Today, I mean, today one of the patients that I had, this beautiful greyhound. The dude had mentioned, or his owner, not the dude, had mentioned for the past. Okay, it's a little bit of a red herring, and you always kind of have to parse it together because the dog had been playing with one of his other dogs over the weekend, and that dog had ear mites. Okay. And so the owner, took the dog home, everything's normal. On Tuesday and Wednesday, so the day before yesterday and yesterday, the dog was kind of scratching at the left ear, and the owner said that he saw a head tilt. So he brought him in today, although he said today he wasn't scratching and no head tilts. And I took a look at the ears, did a swab under the microscope, didn't see anything. And I also did not appreciate a head tilt. So, I told the guy, just because that friend of yours dog had ear mites doesn't mean that they were unlikely that it was transmitted to him. I also don't really have any definitive evidence that would suggest to an ear infection. So there's not really much that I feel the need to do. There was a little bit of earwax, like ceruminous discharge in the left ear, really small amount, but we cleaned that out and sent the dog home. So, I don't really know what was causing it. I also believe the owner that I don't think he's making this stuff up. Whether it was exaggerated or not, I don't know. But, a head tilt can be suggestive of some pretty severe things, such as vestibular disease or an internal ear infection. So things that are a lot sometimes more difficult to treat. For stuff like that, there's different ways to go about treatment. But the dog looked good. So, I don't really know what was causing it.
So I just want to let everybody know if they wanted to go to rockwellpetspro.com and use the code CLEAN. I thought it was going to be ear infection, but no, the code is CLEAN for $10 off natural dog ear cleaner. So that's good. Clean your dog's ears out at home. The head tilt was interesting when you mentioned that. I was like, oh, we haven't talked about a head tilt. But I know you mentioned it could be vestibular. It could be anything like that. Ear infection can cause a head tilt. Can an ear infection cause the dog to be walking funny, anything like that? If he's just anything like that, or would that be more vestibular, do you think?
Probably more vestibular. I would expect the dog with an ear infection has severe bouts of, extreme scratching. They just gotta get it. And then they do it for 5 minutes straight. And then, they're going about their business. Usually no systemic signs. It's pretty localized, whether it's unilateral one ear or bilateral both. And then maybe later in the day, a few minutes later, a few hours later, it's the same thing. You just got to get that itch. And, but I wouldn't expect them to be really presenting with that head tilt for an external ear infection.
When they scratch at home and you hear their collar, ding, 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 as they're scratching away, and they scratch until the owner's like, stop scratching.
Yeah, it can drive owners crazy. And then I think that might be one of the reasons. What was that?
Yeah. They just throw something at the dog to get him to stop scratching. Chuck a pillow at him, and then the dog leaves the room, and then he scratches somewhere else. So
yeah.
But yeah, definitely. But again, let people know rockwellpetspro.com. Use the code CLEAN for $10 off natural dog ear cleaner. Well, I think we're gonna wrap it up here. I can't believe we had our first question of the season.
Thank you, Rachel. Thank you.
That's amazing. I know. I need to email our boss and say, get this lady a present or something. Ask the first question. So, but yeah,
a bottle of ear cleaner.
Maybe we'll see, Rachel. But this is it's been a great show. Any other thing about ear infections you'd like to share with us, Dr. Max, before we sign off today?
Keep them dry.
That sounds great.
That's about it.
Well, I don't know what we're going to be doing next week. We haven't got our schedule yet, but hopefully it'll be something awesome. So I appreciate everybody that's listened this afternoon or this evening. And now the sun is just now setting, which I love. I love the summertime. Hope you have a great week. Dr. Max, have some interesting stuff to talk about next week. And otherwise, we will see everybody next week at 7 o'clock again. See you later, Dr. Max.
Take care, Mike.